Snoring is a red flag. If you hear your child snoring at night, this is a red flag for you to go to the doctor. It's not normal. If a child is not closing his lips when he's sleeping, this is also a red flag. If a child is grinding his teeth at night and you can hear the noise from another room, like many of my, of parents who come to me, they report, this is a red flag. If your child is sleep talking, he's talking through his sleep, it's also a red flag. So a lot of those symptoms, they go to the same story. When a child snores, he's on an oxygen starvation during his sleep.
Derby Talks. Today's guest is a powerhouse of talent, determination, and compassion. She's a dedicated mother of 3, a fighter, and an award-winning pediatric dentist. As a child health expert and ambassador, she has devoted her life to making a positive impact on children's oral health everywhere. But her accomplishments don't stop there. She recently achieved another milestone by becoming a published author. Her first children's book is a delightful adventure that teaches young minds that oral health can be fun, courageous, and joyous. Get ready to be inspired today by Dr. Rafif Tayara, otherwise known as Dr. Smile. You stated that parents should avoid giving their kids juices labeled with organic or 100% juice. Mm-hmm. Now, as a father, that came to me as a shock because these 2 phrases or statements are what makes me so comfortable, and I quickly trust these type of statements that when it comes to organic 100% and 100%, you get the feeling that you are going to drink something that is really natural. So, first question, are such labels then misleading and harmful to the children's teeth?
Yeah, totally. I mean, Wasim, you come from a marketing background, right? You wrote a book about marketing.
So we're misleading.
Exactly. So you know how the industry, right, of retail and, sales and the food industry, right, is, it always has this thing about, using a certain titles on products or certain labels to, to make you buy more, right? And they really play on, the psychology of a parent, right? And as a parent, you want to give your child something organic, something 100%. The only problem is most parents who would buy something, over a shelf at a supermarket, they don't actually know how to read, right, the backside, and where those words are becoming in a super smaller size.
Yeah.
And then the equation there on the back is becoming a bit complex to a normal human brain that doesn't really know about chemistry or nutrition or the number of agents or codes on the back of a juice box. But the reality is that who cares about organic and 100% fruit juice when the juice is actually in a box, of cardboard on a shelf of a supermarket where it has a production date mm-hmm. and an expiry date 1 year later, right?
Okay.
And the only way to preserve, a fruit juice in a box is by putting a lot of sugar and a lot of preservatives. So what most parents don't know is that kids these days are consuming 5 times the dose of sugar that that they should have on a daily basis, and us as parents, filling their systems with so much sugar, especially juice, because those juice boxes are mostly filled with sugar. A little bit of water, a little bit of maybe of vitamins, but mostly of sugar. So that's the problem. Giving so much sugar to children is already, we're seeing the numbers are already showing. We're seeing an increased rate of childhood diabetes. We're seeing an increased rate of obesity in children. We're seeing more attention deficit. We're seeing more hyperactive kids. We're seeing more psychological problems in children. Those are all a direct consequence of our children of today snacking more and having more sugar.
But why are you still referring to this as misleading? What does the term organic mean?
I mean, organic is, when you have a produce, right, harvested in an organic environment in the agriculture perspective. But the problem is, even if that produce comes from an organic perspective, I mean, you're still filling the juice box with preservative and you're adding on it sugar. So that's the misleading part, is that what they add to it for it to become after it's organic.
So when I read stuff like organic, low fat, no added sugar,
Yeah.
I have to keep in mind that everything has preservatives. And no matter how much they brand it, it's still not considered as natural and even might be considered harmful.
The rule of thumb is, if you want to really have the best diet possible for your child, the rule of thumb is stick to everything that goes in a system, or the least, the most, as much as you can, stick to things that have a very, short expiry date. Things
Okay.
that have an expiry date of 2 or 3 days, those are perfect. Because if you squeeze a fruit juice and you put it in the fridge, try to drink it after 2 or 3 days, you cannot drink it. It gets spoiled, right? And there's a reason for that. So my advice usually to parents is that stick to animal protein, give lots of animal proteins for your child, let them chew on, look at the texture of food that they're having, because if you get away from soft food, pasta, rice, nuggets, crackers, those are, everything processed. And if you stick to raw food, food that, the primitive food of human beings, where, we actually chew on food, this is, a great diet system for your child to develop the right size of jaws, to have less crooked teeth, and to have a very healthy gut system.
How much of our kids' cavities are we related to genetics? And as parents, maybe what sort of methods or steps we can follow to minimize their existence of cavities?
First of all, the problem in today's world, first we have a rise of cavities, in the whole planet. We also have a rise of cavities in, Western countries, where, their healthcare is actually considered to be very good.
Yeah.
The GCC actually region is a red zone on the global map of cavities, where we have almost a rate of 80%. So 8 out of 10 kids that come into my practice every day has either a moderate to severe form of cavities. Now, when we look at the causes, or what is the reason, how much of that is related to genetics, it's not a lot, by the way. Only 20 or 10% of the reason why kids have cavities is related to genetics. And genetics only comes when it comes to, when the baby is being formed in the womb of a mother. Teeth start to calcify. So, when in the second trimester of pregnancy, the teeth of a child are already formed, calcified, ready to go. During the genesis process, there's sometimes there would be a disturbance in the calcification process, and this is where what we call a genetic, predisposition happen, and that's why we call sometimes you say his teeth are weak, right, or they have a small defect, and this weakness in certain teeth genetically might give you a higher predisposition to get a cavity or have a hole, because whenever you eat something, the enamel on your tooth is not resistant enough to fight the acid or the sugar on your teeth. Okay. But this whole genetic factor is a minimal risk factor compared to the environment. What is really causing the rise of cavities in the environment. And when it comes to environment, it's the diet, the habits at home that the child has, but a big part of it also is mouth breathing. So the airway is a big part of why, some kids have cavities and some kids who don't. Because kids who breathe from their mouth at night and they open their lips, they have a higher tendency also of having cavities.
Yes. But then how to minimize this?
How to minimize it? By going early to the dentist. So early detection, prevention, taking your child to a dentist, in his first year of life is a major, first step to, to having a very healthy smile. Because we detect things super early as dentists, and then we know exactly how to solve them.
Yeah.
If there's an airway obstruction, we know how to, taking him back to sealing his lips. If we see that, I can tell by looking at a child at the exam, I can tell by the layer on his teeth, by the plaque on his teeth, the quality of it, the color of it, I can tell what he's eating. So kids can't lie to me. About what they're eating. I can tell exactly what kind of diet they're on, and I know exactly how to fix it. So, really juggling or fixing the whole environment of a child in regards to his oral health is a big part of the solution.
Some childs possibly have the issue of snoring. But why is that maybe at the risk of brain damage?
So, snoring again, in our cultures, snoring, sometimes I hear, my child is snoring, but I think it's normal. Snoring is a red flag. If you hear your child snoring at night, this is a red flag for you to go to the doctor. It's not normal. If a child is not closing his lips when he's sleeping, this is also a red flag. If a child is grinding his teeth at night and you can hear the noise from another room, like many of my, of parents who come to me, they report, this is a red flag. If your child is sleep talking, he's talking through his sleep, it's also a red flag. If your child is agitated or hyperactive at school, this is a red flag that, he's not sleeping well. So a lot of those symptoms, they go to the same story. When a child snores, he's on an oxygen starvation during his sleep. So that means that he's on a fight or flight mode to bring oxygen into his brain. And there are images of brains of children sleeping who are snoring that showed damages at the white matter area. So, because, when you snore is really the beginning of sleep apnea, when you stop, when you're gasping for air. So it's snoring is, the beginning, or the fact that, your brain is going through some sort of a damage.
Okay, so if there's that incident of regular snoring by my kid.
Yes.
So what steps do I need to take as a father?
So the steps that you need to take, first, us pediatric dentists, we are able to detect that. So
But why a pediatric dentist? I would never think that's connected.
Yeah, because when I do my exam and my assessment, I can tell if a child is snoring or having issues, at least breathing. Exclusively from his nose. I can tell from the development of his jaws, from the status of his mouth, from a lot of things, and also sometimes from X-rays that we take, routinely in our exam. But another thing that you can do if you miss your dental visit or you didn't go to a dentist is going directly to an ENT, to an ear, nose, throat specialist. And they are fully capable of detecting and treating. Most of the time, especially what I see, at my practice, is that children who snore, sometimes a simple removal of tonsils and adenoids fix the problem. Usually, in most cases, the cause is an upper airway obstruction. So there's an obstruction in their airway system, and sometimes resolving that and giving them a rehabilitation system to go back to breathing exclusively from their nose solves the problem.
Does the same risk apply to adults, or are we only talking about kids?
Of course, for adults, because more years have passed, into upper airway obstruction and snoring, of course, the treatment is going to take longer, and, they have a lot of relapse, right? Because if an adult snores, it means that for years, he's been kind of coping or compensating with that problem. So of course there's a solution. It's just that, the sequela or the impact is more.
Okay, so snoring, cause of snoring is not because you need to maybe, like if the cause of snoring that we understand is possibly due to the way you're sleeping. So sometimes you have to change a pillow, I heard, or so. So is this true? Is this a myth?
No, it's only compensation. So the position that you take might maybe compensate, right? But you're not really treating the root cause. You're just, it's like putting a Band-Aid, on an injury that you have. But there are a lot of factors for snoring. One of them, for example, is obesity, right? If you're more overweight, if you gain weight, it increases your chance, of snoring. But it's also and for adults, it's very different than children.
Yeah.
But in children, mainly is the upper airway obstruction. It's also the tongue posture. So kids who have the habit for years to suck their thumb or to use a pacifier, their tongue becomes low positioned in their mouth, and then the actual touch of the tongue with the roof of your mouth is actually a brain stimulation for a good quality of sleep at night. So if this position doesn't happen, it's also a risk factor to snoring, to not having a proper development of your jaws, and so on, so on. It's like a puzzle.
So for adults who snore, please go and check, please go visit a pediatric dentist or an ENT doctor.
Yeah, I mean, we detect it, but yeah, the best doctor to completely treat that is an ENT doctor.
Okay.
Yeah.
Okay. Apparently, oral health will impact our brain, sleep, and gut. How does oral health impact that?
The quality of sleep is very much related to oral health, because if a child sleeps well, because of the tongue, positioned on the roof of his mouth, what happens is that the jaws and the face develop properly. So they shape to take the optimal size of their jaws. And when your jaws develop properly, your teeth fit properly. And this is why poor quality of sleep is related to crook teeth. And you know how, there's also a rise, statistically, we have today more kids that needs braces than 50 years ago.
Oh, really?
Yeah, not only because of this, because, kids these days and adults also, they have more poor quality of sleep, but also because of our diet, In today's diet, we are chewing less, we are eating more processed food, we are eating higher doses of sugar. So that's also, affecting our oral health and our sleep and our gut.
Yes.
So that's how, it's a puzzle that is all connected.
Okay. So then there's a big percentage of kids that now have crowded teeth, I read. So,
Yes.
and also biting problems. What are the causes of this?
So it's really multifactorial, but because of all the things we talked about, diet, airway, the poor development of the jaws. What we also know today is the deficiencies, especially the deficiencies in vitamin D. So kids who have a deficiency in vitamin, that's why I encourage parents to supplement in vitamin D. It's so important because vitamin D is a vitamin that helps absorb all the other vitamins. So when when a child has optimal levels of vitamin D, then you have a good development of the jaw. Vitamin D is a super important vitamin for a good quality of bone, of jaws, and of teeth. So in a lot of kids, for example, that I see every day that have poor oral health or a lot of cavities, if you check their vitamin D levels, they are low.
Okay.
So that's why it's super important to supplement. Even we live in a very sunny country, and a lot of times kids, they don't go out, right? They're indoors for a long time at school. They come home, they're on a screen or gaming. And, it's true that we live in a very sunny country, but most of the time we are not really exposed to the sun. And even when you're exposed to the sun, there's a very big difference in vitamin D, that you produce when you're exposed to the sun at 5 a.m. in the morning versus the sun at 3 p.m. or 4 p.m. I really encourage to supplement and to making sure that the levels of vitamin D in your child's system are optimal.
And how do we...
Iron. I have to say also iron,
Yes.
because red meat is so important also for children to eat. And more I'm seeing in my practice that kids are not really, they have something against eating meat. And animal protein is something, eggs, dairy, red meat, animal protein is something essential for us as human beings to develop, proper jaws and proper face structure.
What type of food, maybe items, can we suggest to kids to maximize their vitamin D level?
No, supplements are literally like tablets of vitamin D.
But in terms of natural food, where does it come from? Because, these supplements, also some kids might refuse to take them, thinking that there's some sort of medicine as well.
I mean, there's always a way of taking them. There are gummies. Are a good form of taking them. There's a powder that you can take. There's a liquid that you can mix with things. But if everything fails, then it has to be a good exposure to to outdoors, and a good diet based on animal protein, dairy.
Okay.
Yeah, and vegetables.
As you just announced, you recently launched your first children book, Danny and Sarah Go to Dr. Smile.
Yes.
What inspired you to write this book, and what is this book really about?
Many things. Danny and Sarah are my twins. So, so this book is, a full dedication to them. I started writing this book maybe 3 years ago or 2 years and a half ago. One of the things that is a mission, when it comes to writing this book, was to really, as we talked about earlier, reducing, the phobia of kids when it goes to going to a dentist, and really giving them the best condition possible for them to be able to be receptive in a positive way and have a positive attitude when they go to a dentist. So that was one of the missions of the book too.
Okay, so from your experience, if you maybe give a percentage, what percentage of kids, maybe through that age, really have phobia from going to a dentist?
A lot. And at my practice and throughout the years, and where I practice in different countries and in different cities, I would say 70 or 80%,
70 or 80%
of the kids. What helped me a lot is that because I was part of a lot of raising oral health awareness initiatives in the region, this helped me starting to receive kids at a very early age. And we really ideally we want children to come to us before they're born, when they are in their bellies of their moms. That's the ideal situation. That would be a dream to any pediatric dentist, that I do counseling for a pregnant woman before she delivers her baby, because oral health starts when a woman plans for her pregnancy. Okay. That's when the teeth calcify, and that's when all the issues start, and then the window of infectivity and everything. So that's the ideal situation. But in the last few years, I'm very happy to see more babies starting to have to come in their first year of life, and this helps me so much tackling all the issues and preventing them. Because, healthcare, as you know, is all about prevention rather than cure. So if we achieve a healthcare system where we only prevent, that would be the dream, right, for any doctor.
Exactly, yeah. And so your book, just for our audience,
yes.
But tell them more about where can they find this book, where can they buy it, and what sort of age bracket is it targeted?
So this book is usually for school age kids or preschool age. So usually this book would be perfect for a child between 2 and 9 or 10. And this book now is available in the English version and in the Arabic version. I wanted really to do something, in an Arabic-speaking form,
Yes.
because we live in the Arab world, and while raising my twins, I realized that they were bookworms. So I realized that when it comes to children books in Arabic, a lot of the literature was not attractive to the eyes. And not as simple, when you live in an expat country, not supported by a family or support system around you that speaks Arabic. So I really wanted to do this in Arabic too. So the books are available on my website, on Amazon, in Virgin, in Kinokuniya, and in the local bookstores like Booktopia and Bookworms. And we just launched last week in Europe, in UK, Germany, Netherlands, and Belgium.
Dr. Rafif, this was really an insightful podcast. I really enjoyed it. We could have covered more topics, but unfortunately we don't have the time. But this was really amazing. Any last few words for the audience?
No, I really want to thank you very much for having me tonight. It was very interesting and insightful, but also a pleasure, to have met you and having this conversation with you.
Oh, pleasure is all mine. And thank you very much. And really wishing you all the best with your book and
Thank
your
you.
career as well. Thank you very much.
Derby Talks.